Hello, everybody. Belated Happy New Year. Welcome to today's Research America's special discussion, which continues our series highlighting our 2022 Advocacy Awards honorees. Our 2022 Advocacy Awards are going to be held on March 16th, less than 2 months away, and we're really enjoying the opportunity to hear from our honorees in advance of the event. So today we're joined by Sue Peschin, who's the president and CEO of the Alliance for Aging Research. Sue's a thought leader on aging-related health issues and has tremendous experience as an advocate. So we're going to talk to her about priorities in aging research, the landscape for aging issues in Congress, as well as her insights on advocacy and how to affect positive change inside and outside the Beltway. So as always, please type your questions in the Q&A box and we'll get to them towards the end. So with that, Sue, welcome. We're so pleased to have you. And I want to congratulate you and all your members and staff at the Alliance for Aging Research for being selected for our Paul Rogers Distinguished Organization Advocacy Award. So, well, congratulations on that.
Thank you, Jenny, and thanks for doing this today. We are just incredibly honored at the Alliance. I have talked to you guys about how Dan Perry, our founder, knew Paul Rogers and speaks so highly of him. Everyone on my board is tickled about this award. We're just thrilled. He was a great person, and I know, his family is supportive of this. And so we just feel very privileged. So thank you very much.
Terrific. Well, it's well deserved. And your organization is not very big staff-wise. I think you have a staff of about 10. And it's impressive given how much you accomplish. How have you and your team been able to accomplish so much? With a restrained staff? I guess I'm asking you to maybe share your secret sauce. What's your secret sauce for your effectiveness?
I think the secret sauce of any effective nonprofit advocacy organization are the people that work there. And I'm really lucky to have an awesome collaborative staff of just super smart, kind people that know their stuff and, want to be efficient about getting things done and really believe in the mission. We always call ourselves small but mighty. And we have a sweet spot with convening, which is, I think, another sort of part of the secret sauce. We don't just try to do things all on our own. We work with a lot of partners in our health education, public policy, and advocacy efforts. And as an aging organization, we can kind of serve a little bit as a Switzerland in different disease areas. And so we've developed a knack over the years of bringing together disease groups that might not necessarily normally sit around the table together with federal agency folks and researchers, to really sort of look at what are the low-hanging fruit opportunities for both just educational outreach and public policy. And we've done it in a bunch of different areas. And we also look for gap issues. So we don't look to kind of mimic what some of the bigger groups are trying to do. We sort of look at where maybe is there not quite as much focus, but older adults are being disproportionately impacted by something in particular. And then the last thing when I, was thinking about this question is we've been very, very lucky to also get some help and pro bono help from some big firms in town like Aiken Gump and King and Spalding. So they're sort of like our superpower. And I think the combination of all of that is what makes us effective and makes us love what we do all the more.
So you've been a leader in the advocacy arena. You've been at the Alliance since 2012, I believe, and then you've had other advocacy roles before that. What advice would you give your younger self, or what advice would you give a person who wants to embark on a health advocacy career?
I would say, I think a couple of different things. I mean, one is I think, people get really hung up on positions and titles. And I always just sort of went for learning as much as I could. There's nobody who knows everything, even the people who are sort of at the top of their field. And you can contribute no matter what your level, what level you're at, in your career. So, I mean, that's what I've really learned over the years, is just to kind of go for it and make the mission as your focus and to stay focused on that. People get so uptight about inconsequential stuff. And when you make the cause, the center of your focus, then you have your center.
It's very good advice to all of us. So advocacy has changed. It's certainly, I could mention some changes that I've seen. I'm curious to hear your perspective on how strategies for health advocacy, patient advocacy have changed, let's say over the last, 10 or 15 years. What are some new approaches?
Yeah, I mean, I think there's been some positive changes and then there's been some troubling changes. I mean, on the positive side, I think that there's much more recognition of the role of patients and family caregivers in research. And that's been terrific to see. And we've really worked on that with folks that we've partnered with that are older adult patients and want to get involved. So I think the patient voice has kind of taken on a new meaning in research. And then on the sort of not so great side, there's been a lot more attacks against science, a lot more divisiveness, not as much of a willingness to sort of find compromise and work together on things. And then just in terms of having your voice heard, you, I think, would know this better than I, even in terms of just communication, right? And getting the word out. Sometimes it's the people who yell the loudest or have the most provocative talking point, and really sort of sticking to, what's the core message? What are you trying to change? All of that and breaking through has become a little bit more challenging, certainly in the COVID environment as well. And so, I just think you have to be creative in the way that you get out there. And that's also part of the reason why we work with a lot of other groups, is it just creates more of an amplification of whatever it is that we want to get through.
Yeah, that makes a lot of sense. Well, let's talk about some of your policy priorities.
Sure.
And, I guess one question is, you mentioned that you look for some of those overlooked areas that, say, AARP may not be working on, or other large organizations. How do your alliance members help to surface those issues?
Yeah, I mean, I think that we definitely look at trends in clinical development, in medical device, in pharmaceutical research, and NIH research. We work a lot with NIH and on FDA and CMS related issues. So we kind of look for trends and then sort of see who's leading the charge on things and where we fit. And also sort of what interests us and what we think is going to benefit folks that we are serving the most. So just to give you some specifics, the Alliance in the earlier years, I think, worked much more on Alzheimer's disease related issues. That's something that's still very close to our heart, and vision loss. But we've expanded out to issues in geriatric cardiovascular disease, like heart valve disease and atrial fibrillation, in mental health issues, looking at issues of access and value. So, some of those we hear from our constituents that they're important to them, and others it's mostly just sort of keeping an eye on things and seeing where the trends go and where we think somebody needs to speak up.
And that's where your craft comes in. You know, you and your team, right? Having that ear to know what are those issues where your alliance involvement can really make a difference.
Right.
So this coming year, what are some of the issues that you see coming down the path? I mean, PDUFA, I know that you've been, I believe the Alliance has been involved in patient-focused drug development, but I don't want to speak for you. What are some of the things that you will be involved in this year?
Yeah, I mean, I think, you know, the user fee reauthorization is definitely going to be important probably later on this year. And then there's always wraparound legislation with it. Clinical trial diversity is a big issue in this round, as is accelerated approval, breakthrough therapy designations at the FDA, which I think a real focus on accelerated approval with the recent approval of the new Alzheimer's therapy, and just, you know, efforts within the cancer community to try to see, are there areas where they can shore up accelerated approval? So those will be issues. We're going to continue to work on the drug pricing provisions that are included as a part of Build Back Better. We have a project that's called Project Loop that stands for lowering out-of-pocket costs, that's focused on capping and smoothing in Medicare Part D. We are working on the coverage decision on the new Alzheimer's therapy. We actually think that what CMS is doing in this area is opening up the door to using coverage with evidence development, which is a tool that they use to really sort of limit the flow of products and services within the Medicare program. And it's probably going to be introduced for other drugs coming down the pipeline, not just in Alzheimer's disease, but other areas. And we're concerned about that, especially with regard to drugs that are approved through the FDA's accelerated approval program, because there's efforts to dismantle that by ICER and others that we're really concerned about. So we're activating on that. And we started something called the Alzheimer's Disease Policy Task Force, which any of the groups watching are welcome to check out on our website and join us in. Every year we spearhead Heart Valve Disease Awareness Day, which is on February 22nd. And it's just gotten a life of its own. We have over 105 partners now all across the country. Valve Centers, WebMD, American Heart Association, all partnering with us to raise awareness of valve disease. We're going to continue working on the COVID-19 Vaccine Education and Equity Project, which we partner on with Healthy Women and the National Council and Caucus on Black Aging to raise vaccine awareness. We also have a broader campaign called Our Best Shot that raises vaccine awareness in older adults to debunk myths. And it's particularly focused on flu and RSV and pneumonia vaccine. We also have an effort called Project Pause that's focused on psychotropic use in nursing homes for people with neuropsychiatric symptoms of dementia. And then the things that Research America is also heavily working on, the NIH funding and Cures 2.0, all those things are important to us. So it's a lot of different issues. But again, we work with a lot of partners on just about all of them.
You're very involved with PCRI. Could you talk a little bit about that and where you see PCRI heading?
Yeah, I mean, we have a program that's partially funded by PCRI, I should say in large part funded by PCRI. It's called Talk Nerdy to Me. And Nerdy stands for Nurturing Education in Research and Development with You. And we have over 100 patients and family caregivers that have gone through a program. This is one of their engagement programs that they fund to get patients and family caregivers, and in our case, it's older patients and family caregivers involved in the research process, and use their experience to really improve it and serve in advisory roles on federal advisory committees at different federal agencies, on CER, comparative clinical effectiveness research studies at local academic centers near them, with industry. on IRBs and all of that. So that's just very close to our heart. It's one of our favorite programs that we do each year. And then we have worked on the reauthorization of PCRI, which thankfully went through actually right before the pandemic started. At the end of 2019, we were thrilled to get it reauthorized for another 10 years. And we worked very closely with the Partnership to Improve Patient Care on that, and a whole variety of groups, including you all. So that, and to get it reauthorized at full funding for 10 years too. So in terms of where they're going, I mean, I really see a role for PCRI in the coming years to interject much more in talking about value in healthcare, really from the perspective of what matters to patients and family caregivers and providers and other stakeholders in value. Because there's, just been so much going back and forth politically, particularly focused on drugs, but we really should be looking at the healthcare system as a whole and all things that matter to patients. I think they have a huge role to play in funding more kind of head-to-head studies, comparing different types of treatments so that patients and family caregivers and providers have a better idea of what the differences are. I just think that they play a really, really important role in making sure that patients and family caregivers are front and center in any type of public policy discussions that have to do with research.
Excellent. You talked about clinical trial diversity as being one of your priorities. And I know age, in addition to race and ethnicity and gender, age is also an issue. Could you speak about that? It's because it's one that I think a lot of us don't think about, but it's impactful.
Yeah, I mean, the FDA held a great workshop that I think it got a little bit of low play because of everything going on with COVID, which is completely understandable. But they did this meeting in March of last year, looking at drugs and pharmacology for older adults. And in some ways, I think it was in response, the EMA has had a geriatric medicine strategy going on about 10 years now that really looks at what is older adult participation in clinical trials for drugs that are getting evaluated by the EMA in Europe, and also make sure that there's good information that's relevant to the older population. And exactly what you're saying, Jenny, is totally true. There's still a lot of arbitrary age cutoffs in clinical trials. Oftentimes folks who have multiple chronic conditions are excluded from clinical trials, even though they're the folks that are going to be using a new drug or a device once it gets approved by the FDA. So real world experience is key. And oftentimes real world studies aren't published or that information is not conveyed to the older adult community and to providers that serve them. So this was a great meeting, and I was really excited because Dr. Califf, who, of course, is up to be the new commissioner of the FDA, spoke at this meeting. And one of the things, he talked about a couple of different recommendations. One of them was to create an Office of Older Adults at the FDA, which we hope to pursue with him. And he also talked about the importance of pharmacokinetic studies to find out, because, older adults, our metabolism changes, just as it can be different in the pediatric population, can also be different in the older adult population. So there's a lot of things that the FDA could do on this, aside from the guidances they put out over the years. We've been very supportive of, but those don't, unless everybody does it, pretty much nobody's going to do it. So, we think there's a role for FDA to look to NIH. They have a great initiative that they've had for a number of years looking at inclusion across the lifespan. And that's terrific for NIH funded trials, but we need them for the private trials as well.
Right. For the trials that will be seen by the FDA in the submissions. Yeah,
That's right.
it's exciting. I
Yeah.
mean, there's some really important new frontiers. We haven't even gotten into, biomedical and other health advances. But I'm going to stop right now to see what questions we have from our audience. And
Absolutely.
welcome my colleague, Anna.
Yes. Hi, Jenny. Hi, Sue. Great to see you. Yes, we do have a number of questions. And just as a reminder to folks, please feel free to add more to the chat or the Q&A box, and Jenny and I will do our best to ask them. So Sue, one question that has come in the past 50 years, life expectancy in the US has increased by about 7 years due to a combination of factors, including improved medical care and increased access. Do you have thoughts on how we can balance between increasing life expectancy and being mindful of improving quality of life as people age?
Yeah, that's a great question. I mean, certainly you don't just want to extend life, right? You want to extend healthy life. And, unfortunately, actually, in recent years, the life expectancy has either stalled or, kind of gotten behind, particularly in communities of color, with health disparities have an impact on how we age. And some of that is due to diseases of despair, like suicide and opioids, which have gone up over the COVID pandemic. And in terms of making sure that we extend health span, I think part of what we look at around healthy aging is not just talking first of all, prevention and a focus on diet and exercise. We tend not to fund those things as much as we do medication and treatments in hospitals and all of that, which is also very, very important. But, looking at areas where we can promote prevention, I think is key. And then also ensuring that when folks are diagnosed with a chronic disease or condition, that they're taken care of, that it's managed properly. And that's definitely, a huge area of health equity in the United States. I think the other thing too is recognizing that in different groups, depending on what communities they're in and what access to healthcare they have, what level of education they have, the environmental concerns, it's going to impact the age at which they get different types of diseases and conditions. And we don't recognize that nearly enough. If you just look at COVID vaccines, for example, when we were talking about prioritization of groups, do you remember at the very beginning, we all talked about 75 and older, right? Everybody 75 and older should get access to the COVID vaccines. Well, in Black Americans, the average age was 71. So their older age group was not fully covered. Wow. And there were some recommendations made by IOM as to how to do that, but we didn't really follow them. So that's also a key issue, is making sure that we have equity across groups. And we just haven't done a good enough job of that. And that's ultimately the way that we're going to extend healthy years for everybody.
Mm-hmm. Mm-hmm. That is an excellent point. Thank you, Sue. Another question that has come in. So we know a risk factor for COVID-19 is advanced age. And have your advocacy efforts changed because of the pandemic? Like, what has that looked like?
Yes, I mean, we have been involved in COVID-19 issues from the very beginning, actually in March of 2020. When it became apparent that there was a lot of focus on hospitals and acute care settings, very, very little focus, really no focus on long-term care settings and on direct senior services. And so millions of Americans rely on, Meals on Wheels, on home health, not just older adults, but people with disabilities. And so there were a lot of things that we did at the beginning. We partnered up with the National Foundation for Infectious Diseases and the consultant pharmacists, which are long-term care pharmacists, to talk about safe handling of medications. This was when we were all worried about surfaces and, right, like, do you need to wipe things and all that? And we also worked with the National Area Agencies on Aging. So we hosted some webinars to kind of educate folks that ran volunteer programs about how to do all these things safely, because there really wasn't guidance about any of that at the very beginning. We worked to appeal to FDA to make sure that older adults were being included in the clinical trials for the COVID vaccines. We've been participating in the advisory committee for vaccines, the VRPAC, as it's known for short, those meetings, the ACIP meetings at CDC, to educate around how things work in long-term care. A lot of the folks that serve as advisors on the advisory committee at the CDC are in pediatrics, very few folks who have experience in geriatrics. So there was a lot of confusion at the beginning about how do nursing homes work? What's the difference between folks who are there for post-acute care? And that was when a lot of hospitals were transferring people over to nursing homes that were still positive. You know, they were trying to free up hospital beds. And it was a problem in terms of spread in nursing homes in some states. So, you know, we've been involved in a whole variety of issues. And at one point, we even worked with some of our corporate partners when they were allowing folks to volunteer to see if we could help place some volunteers in positions, because it's really a lot of older adults that are the volunteers and do the food delivery and friendly visits and all that kind of stuff. And the COVID vaccine education and equity project we've been working on since late last year with Healthy Women and the National Caucus and Council on Black Aging, with over 200 advocacy organizations. And that's just been an incredible effort where we've done a lot of work with FDA, CDC to just get out the latest and greatest information. You know, across, we have Spanish information on our website at covidvaccineproject.org. And just to promote, talk about boosters, debunk myths, all that kind of stuff. So it's been a real, I mean, it's, you know, this whole experience, I think for all of us, everybody has had issues at different levels. My whole family had COVID. My mom was hospitalized with COVID. So we've had it personally in our family.
Oh my gosh.
And I'll tell you, working on these issues has been like such a blessing, because it kind of gives you something to focus on and get out of yourself and kind of just get away from just all the news and the, you know, the divisiveness and all that other stuff, to feel like, okay, at least we're trying to do something.
I think a lot of us at Research America feel that way too. You know, we're involved in the issues, but at least we feel like we're, you know, on some level, you know, making a difference. I just wanted to jump in.
You are.
And ask.
You are. You guys are fantastic.
I thought you meant you have jumped in.
No. I'm talking about you. Yeah.
Yeah. Thank you. Well, we love working with the Alliance. Adult vaccines, you know, there has not been great uptake on adult vaccines, and there's some really important ones, like for shingles. I mean, they're all important, but ones that even I should probably get and haven't yet, like shingles. Has all the attention to the COVID-19 vaccine, do you think that will help uptake of the other adult vaccines, or hurt it? What do you think the impact will be?
Oh, I think it's helping. I mean, you know, older adults have kind of led the way, right? They were the first prioritization group, so that kind of helped. But they really sort of led the way in recognizing like the importance of making sure that people get vaccinated and bringing more awareness. It's just been fascinating to see the general public talk about safety and efficacy, right? And kind of understand the process of EUA and all these different things. So, I mean, there's definitely been a decline, and the infectious disease groups have called attention to that. We have a program called Our Best Shot, where we promote adult vaccination. And one opportunity that we really want to encourage CDC and this administration to build on was the long-term care partnership that they developed to distribute COVID-19 vaccines in long-term care and in assisted livings and independent living and all of that across the country. It was great for COVID-19. Let's make it happen for all adult vaccines. Because we have, you have those requirements in order for kids to go to school. So in the pediatric population, but you don't really have that impetus in the same way with adult vaccines. We think there's also been great efforts through the Adult Vaccine Advocacy Coalition to really push for better coordination with immunization tracking at the state level. So that's also helped a lot. Better communication for doctors to kind of get that information in there so you can kind of find out what people need. And then also just promoting the Medicare wellness visits where they talk about that, and you can do your prevention plan every year, including talking about vaccines.
And if people want more information on what the CDC recommended adult vaccines are, you guys have a good chart on your website. And so we can post your web address in our chat. But it looks like we have a new question from the audience. Anna, do you want to take that?
Yes. So Sue, this person is asking, are you aware of any research at the intersection between the COVID-19 pandemic and Alzheimer's? Is there any sort of ongoing research, or do you think potential for research there?
Oh, yeah, there's definitely been, some analysis of increased risk among people with dementia in nursing homes. And as I mentioned, there was a problem from the very beginning with transfers from hospitals that put people with dementia, all people really at nursing homes at higher risk. But people with dementia are at higher risk of getting COVID and also at higher risk of dying from COVID. And HHS has done analysis on the claims data from CMS that shows that. Kaiser Family Foundation has put out information on it. So it's been everywhere. And that's part of the reason why I just feel like people with dementia have really just taken the brunt of a lot of what's gone on the last couple of years. In part because of their disproportionate residency within long-term care, in part because of CMS's kind of bad approach to the use of psychotropics in people with dementia who suffer from neuropsychiatric symptoms, which went up much more because people were captive. They had to sort of stay in their rooms and isolate, which is very, very hard if you have cognitive limitations. And then, more recently, the agency called out Alzheimer's disease in their Part B premium announcement, kind of blaming it for increases in the Part B premium. And now they have this super restrictive coverage issue that's before them. So the whole issue with Alzheimer's disease the last couple of years has been very disappointing to see. And that's an area that just needs much more of our focus, compassion, and advocacy.
That's really helpful.
And I
Thank
think,
you.
Yeah, it looks like there's another,
Yep.
All
I was
right,
just struggling to unmute myself, Jenny. Sorry. So Sue, this person is wondering if you have recommendations for strategies for enrolling older people in studies, and if FDA has finalized guidance in that space.
FDA has put out guidance for clinical trial models that are more likely to include older adults, so adaptive type of trials and trials that you can do in long-term care. In terms of actual recruitment, the National Institute on Aging has a program that's called ROAR, R-O-A-R, and I have to remember what it stands for. Recruiting older adults into research, which people should check out. And it definitely gives, some feedback on that. Accessibility, I think, is key, making sure that, folks are not tasked too much for, having to come in and participate. Remote monitoring is made a lot of strides in improving the number of older adults that can be in clinical trials too. So using technology. So there's a lot of things that can be done, but there definitely needs to be more work in the area.
That's great. Thank you. Another question, Sue. How does the Alliance help to prepare scientists to engage with the public? And what about, helping or training advocates to do the same or to engage with policymakers?
Well, our Talk Nerdy to Me program touches on that with patients and family and caregivers. And actually this last year, we also had researchers participate, both as teachers, but also as students. In part because, our older adults, many of them are retired and they're looking for opportunities to engage. So they serve on one advisory committee and then they say, what's my next opportunity going to be? So we're trying to help PCRI expand comparative clinical effectiveness research, and also for researchers to get involved as advocates. And we did that a bit in our reauthorized PCRI, Friends of PCRI effort to get them involved in advocacy. And I'm trying to think, you asked something else about who else in advocacy.
Members of the public or advocates, how they can engage with members of the public and policymakers as well.
Oh, yeah. We have, phone to action that we have on our website that people can sign up and send messages to their members of Congress. A lot of that right now is focused on drug pricing issues and trying to get a cap on out-of-pocket costs in Part D. And people can go to our website, agingresearch.org, to do that. We try to create a lot of videos to, make issues that otherwise might seem technical or hard to watch. In health education as well, just much more accessible and understandable as a way to get folks much more involved and to self-advocate too for their own care. Because it's not always about going to policymakers, but also knowing how to advocate for yourself in the clinical setting.
That's very, very true. So another question, Sue, that has come in. This person says, I saw the Alliance has a podcast called
Yes.
This is Growing Old. And this
Yes.
person is wondering, what was the impetus behind starting that?
So, we've been really lucky over the years to just meet an incredible number of cool researchers and experts and patients and family caregivers. And we wanted to have a way to sort of showcase them and talk to them. And we actually introduced our podcast in 2020. We started it right in the middle of the pandemic. And it turned out to be a really good thing because it was a way to kind of connect with people when they were looking for ways to connect and listen in. And it's grown kind of organically over the years. Janelle Germanos, who was on our staff and recently moved, she was the one who decided to kind of get it going and really just put a lot of energy in it to get it off the ground. Two questions that we ask everybody who shows up on our podcast. I love these. We ask people, what did you envision aging would be like when you were a kid? And then we ask people, what do you enjoy most about growing older now? And so the nuggets that come from that, I think, are a highlight of the podcast. And it's just a lot of fun.
That does sound like a lot of fun, for sure. Another question, Sue, and we have two left here. Are there lessons to be learned from how some other countries address health issues for older folks?
I think there are lessons that are positive, just like I mentioned before with the European Medicine Agency's geriatric medicine strategy. That's not mandated, but it can serve as a good model for a potential mandate in terms of participation in clinical trials, and then also making sure older adults understand information about the medicines that they're taking. On the flip side, I think that other countries, we don't really sort of recognize this enough. In the United States, We don't choose to look at kind of the whole and ration healthcare. And a lot of other countries do that, and they use sort of discriminatory ways with health economic models and use of the quality adjusted life year to validate doing that. And that's really caused access issues, particularly for older people and people with disabilities and people with multiple chronic conditions. And so that's prevented them from getting access in the way that we have here in the United States to kind of the latest and the greatest. And we take that for granted a lot. You know, we don't necessarily have to wait quite as long. I mean, with the pandemic, that's introduced other issues, but typically we have not had to wait as long for things. So in that regard, the fascination that Congress has had with international reference pricing and direct negotiation using these models from other countries would really have a negative effect on a lot of people in the United States, and particularly the most vulnerable groups. And so I think that, you know, what sometimes looks like the shiny new object and what other countries do, paying less doesn't always get you more. You get what you pay for.
Well said. Thank you, Sue. So one last question as we're coming to our time here. Can you tell us what excites you the most for the Alliance this year?
I mean, there's so many different issues that we're working on, and I don't want to play favorites necessarily. I do think that it's kind of a reckoning. I'm going to just pull out Alzheimer's because it's top of mind right now for us. And I just feel like it's such a reflection. There's, you know, there's kind of like the philosophy of the way that we treat the folks that have it the toughest, or that really are the most, you know, that aren't able to defend themselves the most. It's a reflection of how we are as a society. And I just think that this kind of calling out of Alzheimer's by our federal agencies as a way to sort of use it as a cudgel to pass drug pricing, and as a way to, you know, put locks around accelerated approval and hamper innovation. And using that community of all community, not that it would be right for any community really, but to pick that community, it's really a bad reflection. And I just think that we need to, and especially because it disproportionately impacts African Americans twice as likely, Hispanics, you know, 1.5 times as likely. So it's a mirror on equity issues, so many different things. And we need to take a look at what we're doing there, because if we're able to turn it around, it will serve as a model for how we can turn around the bigger issues at large within our healthcare system and just treat each other better. We need to come out of this and do better.
Sue, that is a wonderful way to wrap this up. I mean, your passion, your knowledge, really the scope of what the Alliance works on, it's all just quite moving and impressive. And I've learned a lot. I thought I already knew a lot about the Alliance, but I've learned a lot today talking with you. So thank you so much. And again, congratulations on the Alliance winning the Advocacy Award. And we look forward to seeing you online, at least in March, on March 16th. But really, thanks again. And thanks for all that you're doing for those of us and as we age, and all of us will be there. So you're doing work on behalf of all of us. And I just wanted to lift up one phrase that I loved. You said, we want to extend healthy years for everyone. And I love that concept of healthy years. Mm-hmm. So thanks again, Sue. I'm going to just make a quick announcement about a meeting we're having next week with Dr. Michael Lauer, who's the Deputy Director for Extramural Research at NIH. And this is an off-the-record conversation for our Alliance members. So if you're not an Alliance member, please join us and become an Alliance member. But this meeting will focus on how NIH's extramural grant program is being impacted by current federal funding, including the CR, also issues of workforce diversity, research security, and pandemic preparedness moving forward. So we hope we will see all of our Alliance members at that meeting next Tuesday at 11:30. And until then, thank you so much, and thanks for joining us today.
Thank you.